Hi, my name is Abby Pierce. I'm the dietetic intern. Can you just go ahead and verify your first name, your last name, and your date of birth for me?
Lizzie Pierce, June 11th, 1999.
Perfect. So basically your doctor has called me in to perform a nutrition-focused physical exam on you. And basically what this is just a head-to-toe assessment of your muscle stores and your fat stores and just checking to see if you have any micronutrient deficiencies that would be evident physically. So what I'm going to go ahead and get started with first is just taking your blood pressure. So I'm just going to go ahead and put this cuff on you and we'll get the reading from the machine. So the normal blood pressure reading for the average person would be less than 120/80. So we'll just wait and see what your reading is. But if it's higher than that, that can indicate hypertension, which means that you might have some issues going on with your heart. And if it's lower than that, again, it could also mean something wrong with your heart that would indicate it's not pumping blood as well as it should be. So that would just be something that we would need to take some more tests about and see if there is a real issue there with that. So your blood pressure is 110/72, which is in the normal range. So nothing about your blood pressure is concerning. We don't need to do any further tests there. So now I'm just going to feel on your radial pulse. I'm going to palpate here for about 30 seconds and just check your heart rate, making sure that it's not abnormal, it's not too slow or too fast. So the normal heart rate is 60 to 100 beats per minute, and your nurse did report that yours was 71 a couple hours ago. So I'm not feeling anything abnormal with your heart rate. It seems to be normal. If it was going too slow or too fast, that could just mean that you have some things going on with your heart. It could also indicate atherosclerosis or heart failure of some sort. So next, I'm just going to check your respiratory rate. So if you can take a couple big deep breaths in and out for me. I'm just inspecting your rate, your rhythm, your depth, and your effort of breathing, just to make sure that you have nothing going on with your lungs or heart. Do you have any issues breathing normally? Have you noticed any fast rapid breathing or shallow breathing?
No.
Perfect. So I'm not noticing anything abnormal with you, and your nurse also did report that your respiratory rate was 18, and the normal rate for respiratory rates are between 12 and 20 beats per breath per minute. So everything looks normal there with your vitals. Okay, so now I'm going to go ahead and move forward. I'm just going to start up at your hair. I'm checking for any breakage, balding spots, any dryness or flakiness of the scalp, any extra thinness of your hair that would be of concern, but that all looks good. So next I'm going to go ahead and move forward to the cranial nerve portion of the exam. So I'm just going to shine this light in your eye, and if you could just look straight at me at my nose. I'm just going to hold the light up and look into your eyes, and then go ahead and look at my right ear and my left ear. Perfect. And now I'm going to ask if you could just raise your eyebrows nice and tall. Perfect. And now go ahead and follow my finger. Perfect. Now if you could just puff your cheeks out like that. Perfect. And then stick your tongue out and move it side to side. Perfect. Now I'm just going to place my hand on the side of your face and just push your face against my hand this way. Perfect. And then push it again this way. Perfect. Okay, so I'm going to go ahead and move forward. I'm just going to start out here by feeling your temporal mandibular joint. If you could just open and close your mouth a couple of times. I'm just listening here for any snapping or clicking and feeling for a smooth range of motion. I'm going to go down here and feel your masseteres. If you just, again, keep opening and closing your mouth. Perfect. And then I'm going to feel your temporal muscles up here. So if you could, again, just keep opening and closing your mouth, making sure that that's all working properly. And then your pterygoid muscles. So if you could just move your jaw forward, I'm going to feel underneath. Perfect. So there's no anything prohibiting range of motion with your jaw muscles, and there was also no snapping or clicking. So that was all perfect. That wasn't abnormal at all. Perfectly what we would expect in a healthy individual. Anything abnormal that could have come from that could indicate that you might have some issues with your jaw and chewing your food and being able to eat food, which might restrict you from eating orally. So I'm just going to continue on and feeling your orbital fat pads underneath your eyes. I'm palpating the region here, and the skin should be bouncing back after I touch it, which it is. In someone who could be malnourished, they just might have very severe sunken and depthness under their eyes in the orbital region over here, or discoloration, dark discoloration under their eyes, which you don't have, so that all came back normal. And then I'm just going to feel your temporal region up here in a scooping motion, making sure that you have nice, adequate muscle stores up here, which you do. In someone who is malnourished, their temples would be very sunken in, and there would be a lot of depth, meaning that there's not adequate muscle stores up there. But nothing of that is an issue for you. I'm going to go ahead and move forward. I'm just going to palpate your buccal fat pads and make sure that, again, the skin is bouncing back nice and springy to me. Just checking to make sure that you have proper fat stores. And someone that would be malnourished, they wouldn't have proper fat and muscle stores in that region, and it would be very sunken in. Obviously, that's not the case for you. So now I'm just going to take this flashlight. I'm just looking around your lips, checking the outer corners of your lips, making sure they're not dry and flaky or extra red. Again, that your lips are extra red or pale in color. That can indicate colitis, but that doesn't seem to be prevalent in you right now. So I'm going to go ahead and move forward. If you could just open your mouth, I'm going to inspect your labial mucosa down here and up here. Again, I'm also just looking at your gingiva, making sure that they're not red or inflamed. Same with your labial mucosa. And I'm now moving into your buccal mucosa, checking for any white spots or redness in either of these areas. I'm just checking your tongue for symmetry, making sure that it's nice and even. If it wasn't, that could indicate something wrong with your cranial nerves. Also looking at your papillae, making sure that there's some rigidness there. If it was smooth or glossy, that could indicate an abnormal finding. And then if you could just open your mouth nice and wide and stick your tongue out and say, ah, I'm going to look now into the back and make sure that your soft palate is rising adequately when you say ah, which it is. And then if you could just stick your tongue up. So I'm just looking on the floor of your mouth again, looking for any white bumps or redness, irritation, looking for any purple or dark colors under your tongue, which doesn't seem to be an issue. You can go ahead and close your mouth now. So nothing abnormal came from your intraoral screen. Everything looks to be in good condition. There wasn't any inflammation, redness, any white spots, which could indicate carcinomas or oral cancer, so that all looked perfect. And then I'm just going to ask if you could tilt your head up a little bit. I'm just going to inspect your neck down here and check for any abnormal bulges or what we would call goiters, which could indicate iodine deficiency and the abnormal swelling of your neck. But everything looks fine there, so nothing is of concern. Doesn't seem like you have any muscle wasting or fat loss in your head area. Next portion of the physical exam is going to be your dysphagia screen. So this is just checking your swallowing function and making sure everything looks normal and is working properly there. So first I'm going to ask if you can just give me a nice big cough. Perfect. Did you feel anything abnormal with that? Any complications?
No.
Okay, perfect. So the next part of this is I have this cup of water here, and I'm just going to ask that you drink this continuously. Don't stop. Just drink the whole thing until it's gone. And I'm just going to have my hand placed right on your throat just to feel when you're swallowing. Okay? So go ahead. Okay. Perfect. Do you feel any fluid stuck in your throat or anything like that?
No.
All right. So I'm just going to stand here for another minute or so and watch you and assess and listen for anything that might be abnormal, if you have any water that's regurgitated or any changes in your voice or anything like that. Okay?
Okay.
All right. So now that it's been 1 minute, how do you feel now? Anything abnormal going on in your throat?
No.
Perfect. So you've passed the dysphagia screen. It means that your swallowing functions are working properly and you have no risk for aspiration, which is perfect. All right, moving forward, I'm just checking your clavicle region, making sure that you have proper muscle stores, which you do. And someone who would be malnourished, their clavicle would not obviously be covered with muscle, so it would be very bony, prominent, and protruding. That's not the case with you. Following down your clavicle, I'm going over your acromion process here. Again, making sure that you have adequate muscle stores, which you do. In someone who would be malnourished, they wouldn't obviously have the muscle stores up there, so they would have very squaring of the shoulders. Their bones would be very prominent and protruding out here. That's not the case with you. Moving forward, I'm just holding your hand up and putting your arm in a 90-degree angle to feel your fat stores in your tricep area on both sides here. Again, using my thumb and forefinger, pinching the fat and not the muscle. In someone who would be malnourished, they wouldn't have proper fat stores underneath here, so their triceps would be very bony and prominent. Obviously not the case with you. Flipping you around here, if you could just press up against that. We're going to be checking your mid-auxiliary, your anterior, and your posterior auxiliary line, and your iliac crest down here. So again, we're just feeling for proper fat and muscle stores, making sure that you have good fat covering along both your front and back ribs, and making sure that you have proper fat covering your iliac crest, or also known as your love handles. And someone who would be malnourished, they wouldn't have proper fat and muscle stores over here. So your iliac crest bone would be protruding, and your ribs would not have fat covering them and would be very bony and prominent as well. Okay, so next we're going to go ahead and move and look at your nails. So here I'm just checking for any spoon shapedness of your nails or concave nails, or any central ridges that would be indicating an iron deficiency. So have you noticed if your nails are extra brittle or break apart very easily?
No.
Okay, perfect. So, and if that was the case, if your nails are very brittle, soft, dull, broke apart very easily, that could just indicate that you might have a magnesium or vitamin A deficiency, or it can mean that you are malnourished. So now I'm just going to ask if you can just squeeze my hand nice and strong, just checking for your hand grip strength here, and you were able to grasp it very well. And someone who is malnourished, they might have a diminished ability to grasp and hold on to things. Their hand grip strength would be weak. So obviously that's not the case with you. So now I'm just going to ask if you can make an okay sign like this so I can check your interosseous muscle. This muscle right here in between your thumb and your forefinger. And the muscle is very prominent here. In someone who would be malnourished, this muscle wouldn't be prominent. It could have a depression or loose skin over here, which is not the case. So everything with your hands and nails looks perfect. Moving forward, I'm just checking your scapula region here, making sure that you have proper muscle stores across your scapula, which you do. Again, checking down your spine, making sure you have proper muscle and fat stores covering your spine, which you do, and back along your ribs back here. So in someone who would be malnourished, their scapula would be bony and protruding, which isn't the case with you. Again, your spine would be visible and the ribs on your backside would be visible, which is not the case. So I'm going to go ahead and move forward. I'm now just examining your back, making sure that you have symmetry and that it's not concaved or anything. So I'm going to go ahead and check your chest expansions using palpation. I'm just going to put my hands back here. If you could just take a couple deep breaths in and out. Here I'm just feeling for the range and symmetry of your rib cage as it expands and contracts. Abnormal findings would indicate that you might have a bronchial obstruction in your upper airway or nerve damage that would prevent you from both sides expanding and contracting symmetrically and being able to take deep breaths in and out. And someone who might have an airway obstruction, they wouldn't be able to do that. So now I'm going to go ahead and just assess for tactile phremesis. So I'm going to put my hands in a V shape on your back, and if you could just say the phrase 99 as I keep moving down so I can feel your vibrations of your airways.
99, 99, 99, 99, 99.
Perfect. And then if you could just turn around, we'll do it again on the front side.
99, 99, 99, 99, 99.
Perfect. So I was able to feel your chest vibrations perfectly during that, which just means that you don't have anything obstructing your airway that could prevent you from breathing properly or eating or chewing. So everything looks good there. So next I'm going to go ahead and move into the cardiac assessment part of the nutrition focused physical exam. So I'm just gonna take your arm here and I'm gonna just rest your hand on top of your head and then just relax a little. Don't feel any tension or stiffness. And then I'm just gonna be assessing here for your second left inner space, your second right inner space, and your internal apex beat. So I'm just gonna go ahead and place my hand over here and palpate the region, feel along here, and feel down here. So that all seems fine, nothing abnormal came from that. You can go ahead and put your hand back down. There was no tenderness, hollowness, or stiffness, which is all good signs. So I'm gonna start here by palpating the right upper quadrant. We're checking here for your gallbladder, your pancreas, and your liver. Do you have any discomfort here when I'm touching you?
No.
Okay, perfect. So next we're gonna move down to the right lower quadrant. Down here we're checking for your appendix, the lower right portion of your kidney, and your right ovary down here. Do you have any discomfort when I'm touching you down here?
No.
Okay, perfect. Next, we're moving to the left upper quadrant up here. So this is where we're checking again for your spleen, your pancreas, the left lobe of your liver, and your stomach. Do you have any discomfort up here?
No.
Okay. And then lastly, we're going down into the left lower quadrant. Here we're feeling for your colon, your kidney, and again, your left ovary. Do you have any discomfort down here?
No.
Perfect. So that's concluding the abdominal exam. I did not feel any distension. There was no swelling, which would be ascites. There was none of the fluid buildup there. The color of your skin looks good. There's no yellowing of your skin or dark spots anywhere that could be abnormal. So everything with your abdomen looks good and there was no discomfort, so that's also good. And we're gonna assess your quadricep muscles. So I'm gonna take your leg and prop it up here. So as we can see, your quadriceps are up here. Here we're just assessing for muscle and fat, and as you can see, you have a good separation between fat and muscle up here, which means that you are properly nourished. And someone who might be malnourished, there wouldn't be as much muscle or fat on the bottom. So everything looks good here. When I'm palpating it, it's all bouncing back, which could mean that there would be edema present. So that's good. And again, your skin has a good color. There's nothing concerning about the color of your skin down here. No looseness of the skin either, which is good. So next, I'm gonna move down into your patella region. So I'm just gonna cup my hands like this. I'm feeling above your kneecap up here to make sure that there's no excess boniness or prominent protrusion of your bones up here. I'm cupping on the bottom of your kneecap down here, again, feeling your bone and your muscle. And then I'm moving around up here on the top and just feeling up here. So all of this on your kneecap looks good. You don't have excess protrusion of your bones. And someone who would be malnourished, they might, again, not have as much muscle or fat stores. So your kneecap would be abnormally protruding, but all of this looks good up here. Okay, so the next portion of the exam is assessing the gastrocnemius muscle or the calf muscle down here. So really I'm just checking to make sure that the calves are symmetric, which they are. I'm also palpating the regions here and looking to see if there's any depressions after I press on the calf region, but the skin is bouncing back nice, so that means that there's no swelling or edema present, and there's adequate muscle stores here, so there's no malnutrition or, again, muscle wasting. And someone who would be malnourished, we wouldn't see all of the muscle back here, and it would be very bony. So here, I'm just assessing the size of your ankles, making sure that they look symmetric, which they do. There's no swelling or fluid buildup, which in the ankle and feet region, the lower extremities of the body, that's the most typical place for edema to be present. Again, I'm just palpating the tops of your feet down here, making sure that the skin's bouncing back nice and adequately, which it is. So nothing about your lower extremities here would indicate any malnutrition or edema. This concludes our nutrition-focused physical exam. Nothing alarming really came from this. Again, there was no signs of malnourishment. You didn't have any muscle loss or fat wasting. When I was looking into your eyes again, there was no signs of jaundice, nothing abnormal inside of your mouth that could indicate anything wrong there. So your skin turgor was perfect. There was no tenting of your skin. When I pinched it, it fell right back down. There was no signs of edema. Again, when I was palpating your skin, it bounced right back up to me like normal. And your nails looked perfectly fine. So that's, again, concluding the nutrition-focused physical exam. There's nothing concerning here that I should mention to your doctor, so I will pass the results along to your doctor and hopefully you'll be discharged soon.
Thank you.